again, another day and another increase in the numbers, and another reiteration from me and everybody else on the call of how important the social distancing is. We have added, as you're going to hear about a little later, some more granularity and detail further actually to the dashboard, the county's dashboard that we've been sharing and we've all been looking at. And I think you'll find it useful because it helps understand why controlling that curve is important and the relationship between cases and our capacity to deal with them. Again, I want to reiterate that the disparity, the striking disproportionate impact on the African American community continues. And it's, you can look at the bar charts and see it's not a little bit disproportionate, it's massively disproportionate. I want to also, on a separate note, thank the state legislators for passing, as you saw, their bill. There is, just to be clear, I'm grateful for that. But I can tell you, because the county is providing a lot of direct services and we are seeing just more and more strains on our staff, we're going to need more. So I am grateful for their action and look forward to working with them to make sure that the largest county in the state is able to continue to be, as it always has been, the biggest contributor to the state. And also, we save lives, which we all want to do. So with that, I will turn it over to the mayor.
Thank you very much, Mr. County Executive. As we focus on the racial disparities, which are extremely important, we have to recognize that one of the big keys to dealing with this in the short run is expanded testing, so that we can test individuals, get them isolated, and then do the social tracing that's necessary so we can control this. As I looked at the dashboard this morning, I couldn't help but notice that the largest census tract that has now been affected is no longer, at least as I could see, it was no longer in Sherman Park, but is now northeast of Sherman Park, in the area along Capitol Drive and just north of Capitol Drive. That census tract had 30 cases. On the south side, 53215 is continuing to be a place that we have to monitor as well. So there are now 3 areas: the Sherman Park area, 53215 on the south side, and then 53209 zip code, where we're seeing a disproportionate number of cases. So we have to have our focus there. We have to continue to press to have more expanded testing, and that's something I'm going to continue to do, because we know to turn the corner, that's what's going to be necessary. But I thought I'd run through several other factors that are necessary for us to try to get back to normalcy, because I think as this goes on and more businesses are affected and more people's livelihoods are affected, they want to have hope. And they want to know, okay, what specifically is necessary for us to be able to get back to life as normal? And so there are really, what I would say are 5 indicators that are important for us to look at to get life back to normal. The first is the number of cases. And that means a sustained reduction in cases for 14 days. I think we need to go back to last Sunday, Easter Sunday, because there were religious activities that took place. But if we can see a sustained reduction in cases for 14 days, I think that's a start. Second is the testing. And this is where we're nowhere near where we need to be. But we have to have testing availability for all people who have COVID-19 symptoms. And I know that this is being ramped up. I talked to one of the private providers this morning. He believes that they've got a lot of capacity that will allow them to do it. I still believe that there is a challenge if it has to go specifically through a provider, because so many of the people we're talking about don't have a provider. And so what are we going to do for those individuals who do not have a provider? How are we going to get them to get tested? So that's a place where we have to have a lot of work being done. The third component is the care. And that means having the hospitals have the ability to treat all patients requiring hospitalization without resorting to crisis standards. Now we're ready and we're getting closer to having the ability, even when there are crisis standards, to do it. And Dr. Weston, who we're happy to see back, congratulations, doctor, as a new dad again. But we want to make sure that component as well. Another one where we really have not gotten over the hump at all is on the PPE. And that's something I can tell you, our office today received 8,000 surgical masks from Jake Gian from Red Crab Seafoods. And he brought them into our office, and we'll share that. We're continuing to ask people for the face masks. I think you saw in New York City, you saw in Los Angeles, that they're now requiring face masks when people go out in public there. We haven't done that here, but that is certainly something that may be explored. But that's something we have to have, that PPE equipment available for the first responders, for other people who interface with the public, and then for the general public as well. And then finally, if we're going to get back to normal, it's going to be because we have the tracking. And the tracking is something the state has stepped forward, and I'm very thankful. They've accelerated their tracking efforts with us. But the ability to count, to trace, to monitor these cases and the outbreaks in real time, that's once we get those pieces in place, that's when I think we can start bringing more people back to work. So that's what our focus is. That's what my focus is. But let's just keep, for all of these different components, let's keep moving as hard as we can so we can get life back to normal. Thank you.
Thank you. Good afternoon. I want to take a moment to focus on our public-facing dashboard. I'm going to pull that up here. There we go. And some change that we made to enhance both the stakeholder as well as public understanding the current and ongoing trends associated with COVID-19 cases in our community. You can see we're currently at 1,937 confirmed cases in the county and 99 individuals who have died. First, you can see a new version of the map here that breaks down each census tract into number of confirmed cases per 100,000 residents to give a more accurate per capita density of cases in different parts of our community. This and other overlays can be found by selecting layers in the upper left of the map here. Second, we've added in the lower left and lower right graphs these extra tabs. I'll click both of them for confirmed cases and deaths. A bit of a different view that demonstrates the number of cases and deaths added each day. And this may help better appreciate the trends that we're seeing on a day-to-day basis. And it's important to remember that due to the nature of lab testing, the nature of case investigation, there's inherently a few days of lag time in obtaining the true counts for both these measures. So that means the last few days may change as new data arrives. Next, in the interest of adding transparency and to honor our commitment to racial equity and reporting inclusive and accurate data, we've dug a bit deeper into the state data to include both race as well as now ethnicity in the confirmed case demographics over here. Now including the census definition of Hispanic or Latino of any race as an independent category. So this further outlines the immense disparities that COVID-19 is underscoring in our communities, as well as many other communities across the nation. Finally, by clicking the tab down here, as promised at the end of last week, we've added a public-facing dashboard to better understand hospital resource trends and capacity. As our hospitals in Milwaukee County are collaborating like never before and supporting each other like never before, we're showing the combined data from all the hospitals as one. And so you can see the number of hospitalized COVID-positive patients here, total ventilator usage, in addition to the ranges ICU and floor usage. And then in the orange, you can see the ranges that the systems are able to flex to. The bottom of the orange is kind of their conventional state, and then the top of the orange provides the capacity they're able to provide. And so this should provide better context into how COVID-19 is affecting our hospitals and what capacity is available in our hospitals. Although initial signs appear that social distancing is helping to flatten the curve, as other speakers have said, this is not a time for complacency, but rather for continued vigilance and perseverance in staying home and social distancing. We'll continue to watch the trends to inform decisions as to the duration of social distancing, but with modeling of trends being so variable as to what is to come, we're working with our hospitals and alternative care facility to ensure that we're able to best care for future patients in need. So I spent a lot of our time today on the dashboard. We've worked hard to make this dashboard a single source of truth and knowledge in a time of confusion for many. We're committed to informing the public of the situation in our community, especially the disproportionate effect that COVID-19 has had on our more underserved communities. and using these statistics to aid in dissemination of resources and collective efforts to the most disparately impacted residents. We're honored to have our dashboard serve as a national model of inclusive, complete, and honest reporting. Now, at the end of this conference, you'll also hear from my assistant medical director, Dr. Matt Chin, who's supporting the oversight of Milwaukee EMS medical operations. So more to come there as well. Thank you very much and stay safe.
Thanks so much, Dr. Weston. Next, we'll hear an update on a few additional issues from Ann Christensen, who's the health director at the North Shore Health Department.
Yeah, hi. Thank you again for having me. So I'm Ann Christensen, as Brian said. I represent the North Shore Health Department. So we're one of the 11 local health departments here in Milwaukee County, and I serve the communities from Shorewood up to Brown Deer, so the northern part of Milwaukee County. That's about 65,000 residents. And we really are in public health on the ground floor of the pandemic and seeing things in real time in terms of the cases as well as the impacts that the disease has on people's lives. I do want to share or reiterate what Dr. Weston said in terms of Milwaukee County seeing 75 new cases within the last 24 hours, and that would include 4 fatalities. So again, the impacts of COVID-19 continue in our communities, and we're certainly not stopping our efforts at the local health department level. In terms of the state information too, that's also helpful, I think, for our residents in the Milwaukee County area to know. But there were, within the last 24 hours, 166 new cases in the state of Wisconsin. So again, while we're seeing a flattening of that curve, we're definitely not seeing any declines in those numbers by any stretch. That would include also 12 fatalities. So again, the impacts of COVID-19 are real, and they're affecting both our community as well as residents across the state of Wisconsin. So as I mentioned in other briefings, our goal in public health is to slow the spread of COVID-19. We're doing that in a number of ways, and we appreciate everybody's role in their physical distancing measures and abiding by the stay safe at home guidelines. We're cautious that at some point we'll be able to lift these measures, but we know that, and as talked about earlier, there's necessary tools that need to be in place before we can do that. One is the expansion of testing capacity, both through our healthcare providers, but also through other clinics, potentially adding mobile sites for testing as well in the future. But that testing capacity really has to be there in order for us to be confident that we're able to know how prevalent COVID-19 is in our communities. So that's one of the indicators that we're looking for. And then there's another component, which is what we do, as I mentioned, in local public health every day, and that's this idea of contact tracing and investigation of those cases. And essentially what that is identifying those who are positive with COVID and then determining who they've been potentially in contact with during that infectious period. Our work in local health then identifies those individuals and determines whether they've been at low risk, low, medium, or high risk, and then recommend strategies based on that risk assessment. If they're in a high or medium risk level, then we're going to recommend a quarantine for those individuals, which is a 14-day period. And that allows that person to determine, or that person's body to determine whether they're going to move on to develop the disease or not. And so by quarantining somebody, we've really stopped the disease spread with that individual. And so that's why contact tracing is so important and such a key component to have in place for, again, any easing of social distancing and physical distancing measures, because we want to have that robust system so we can create that circle around somebody who has the disease and stop the spread right there, instead of having further transmission in the community. So again, one of the important parameters. And as other mentions of adequate PPE, we're really not there yet in terms of making sure all of our healthcare workers and first responders and staff that need that PPE is there. So having adequate PPE is another important measure that we want in place in order to feel confident that we can go about our business in managing COVID in the community. So those are really a couple of important things to note. I did want to make note of some of the data that Dr. Weston had mentioned in terms of some of the discrepancies with the fatality data. I believe that came up yesterday. It's a matter of complexity with just getting the right information from both the Milwaukee Medical Examiner, but we're dealing with medical examiners and coroners from other counties too. And so making sure all those data are synced so that we have the right information on the OEM website. So sometimes it's just a matter of time and making sure that the data are synced both at our county, but also in other places too, because we know some of our fatalities are occurring outside of Milwaukee County. So again, this is hard for everyone. We recognize that. We know that this is really continues to be an important time period in the spread of the virus, where we're seeing impacts from the social and physical distancing measures. We want to make sure that everybody continues to listen to those guidelines and stay safe at home. So continue the good work that we're doing, and we appreciate it here in Public Health. Thank you.
Thank you, Director Christensen. And next, we will hear from Nicole Brookshire, the Director of the Office on African American Affairs.
Good afternoon, everyone. Thank you for inviting me onto today's call to again help support and stress the urgency for staying at home and keeping everyone safe. In support of what was shared by Dr. Weston as well as Ann Christensen earlier, as well as the county executive and mayor, I cannot stress enough the importance of really taking this COVID-19 seriously. Secondarily, to really help share the information across your networks. Some of the information that I highlighted on Friday was really making sure that we heard from community. So I want to reiterate that need still today. OA wants to continue to help play the role in wearing various hats, but play the role in helping coordinating some of that conversation so that we can continue to bring it to community, but listen to community and bringing that back inward to our internal channels at the county, but inward to all of our other partners that have been at the table from day one and continue to take COVID-19 extremely seriously. So I think a lot of what was shared today highlights that these disparities have happened for quite some time at an institutional systemic level. And we know collectively we need to come together and stay together to eradicate it. We anticipate, from my lens and looking at the data, I anticipate that there may be more that we could see in the coming weeks. But doing this by staying at home is our first measure to, again, help flatten that curve. If you would like to reach out to my office specifically, I welcome those opportunities to really converse with partners and those in the community to help us have that messaging concrete, but also helping us become aware of who is able to offer services, where those services are, and to the point of the mayor and the county executive. If those are circulating around those particular zip codes now, we really need to know and have that information so that we can make sure we have enough of those services and awareness is there to help the residents that are in need right now. Thank you again for all of our frontline workers, those that are essential, those that are healthcare workers. We could not do this without you. Thank you for your time today.
Thanks, Director Brookshire. Next, we'll hear from Dr. Matt Chin, who is the Assistant Medical Director at the county's Office of Emergency Management, and he has an update for us on the EMS system.
Thank you very much, Brian. I appreciate the opportunity to speak. I just wanted to provide a brief update on our EMS operational issues in Milwaukee County. Regarding personal protective equipment, obviously to protect our citizens and our first responders, we're following established national guidelines for the use of personal protective equipment when responding to 911 calls. As been mentioned before, EMS personnel responding to calls may be wearing protective equipment that looks different than what we may have been using prior to this pandemic beginning. Though this may appear at times intimidating to the patient, please know that this equipment is meant to protect patients and allow our first responders to stay safe and continue to serve their communities. We do want to remind people that donations of new and unused personal protective equipment are still being accepted at the Wisconsin State Fair Park, specifically the Tommy Thompson Center from 7 a.m. to 7 p.m. 7 days a week. We'd also like to recognize the interagency cooperation that's been going on between all health sectors. There's been an extraordinary level of cooperation and collaboration, as previously mentioned by Dr. Weston. EMS has been a model for this interagency collaboration. All EMS agencies within the county have been fantastic about resource allocation and sharing, regional EMS responses, intellectual sharing, and overall continuing the excellent level of emergency care we have come to expect from our first responders. Lastly, we continue to respond to 911 calls within the city and county and transport all patients who need and require emergency services. I'm pleased to say that we are seeing a stable volume of 911 call volume, as well as patient encounter volume, and we continue to monitor the situation closely. We've seen a slight downtrend in our patient transport volume, likely secondary to COVID concerns causing more patients to choose to stay home rather than be transported. For patients we encounter in calls where after evaluation, the patient may opt to stay home, we have trained our providers to provide these patients information on symptoms of worsening disease and when the need may arise to re-engage with the 911 system. We're also working incredibly hard to follow up with COVID suspected patients who choose to stay at home to ensure their symptoms are not worsening and advise on next steps. As has been mentioned many times before since this began, we always encourage people to utilize the 911 system in our emergency departments for only life-threatening emergencies.